This is a central control area for the hospital, and so we have, when people are checked in the morning, those animals are getting some type of therapy today, and we have 3 wards on that wall. They're not, you know, and then we have our hospitalized cases over here. Right now there's nothing in there. I think it's pretty quiet today. But we have our treatment boards for each doctor. I'm not in, but I still had some treatments I had to do this morning. Dr. Johnson's gone, so just Dr. Birchfield today. And those are just animals that are dropped off for the day, or, you know, drop-offs or surgeries or that kind of stuff. So, control drug area and locked drug supply area, because you know how much that stuff's worth.
Yep. Yep.
And then we have our fecal station here. Now, initially, the reason I wanted it here is because I didn't want contamination of other areas. The other reason is because it's got an exhaust, so we don't smell it. You know, the big smell thing. And plus, with this and vibrations and stuff, you just don't want that on your computer stations and stuff. So over here, so we have a dog ward, a cat ward, and then also a large dog hospitalization, which is nice. We have so many giant breeds that come in here that it really works out well.
I just love that idea of
the doors.
Glass doors.
Yeah,
the same.
It just makes all the difference. And you know, if we have a patient that has low body temperature issues, we just turn the heat on in there. We just put a little area heater in there and get the temperature up to 80, 85 to really warm
so
their
you can
body
control that separately?
I do that with just a remote thing. Yeah, we can control that separately. And then the other thing is the ventilation system. All these wards have ventilation that goes right out the building. All the air is sucked through here and out the building, so you don't have any cross-contamination.
Don't you have a more heating bill that way, because you're sucking in?
Oh yeah.
Yeah.
Yeah, our heating bill's pretty hefty.
It's almost like when you have a car and then you can set it that the air comes in from outside straight and goes out. Or
it would be nice if that could happen, but and it does to a certain degree. But because of the, you know, I mean, it's coming in from out here, and of course that's from air return, and 20% is fresh air coming in all the time. So it does have that flow. And then we've got the double dental stations, and we really only use one station at a time right now. But when we're doing ultrasounds and stuff, we do those here, and so we get we get an anal gland we've got to wash up. Where we're doing dentals, we're fine. You know, in the old place, I had one of these tables and one of these. That's it.
Yeah.
Now,
I remember.
Now back here, I have 6 tables back here, because I wasn't going to put up with that anymore. I built this clinic for, the biggest thing I built it for was not for what I needed 3 years later, but what I needed for 6 years later. Because we still don't use all of it. You know, our efficiency would be, we can produce twice as much as we're producing and not be stressed on it. So
I really liked your idea, which was the same at Log Cabin, is that in the exam rooms we didn't do anything, any injections, any painful stuff, you know, and the clients love it. And we used to think that the clients wanted to see everything.
Right. And they don't.
And they don't.
No, they want their animals to be cared for properly and stuff. Here's this is our O2 room.